Hi, I'm Marianna, and I'm here with Dr. Papageorge, who is attending the AATS meeting for the first time, and she has the honor of presenting tomorrow. I'm hoping we can talk a little bit about your abstract and what led you to do this research.
Sure, absolutely. So the presentation I am giving tomorrow is focused on the counting of diversity-related presentations and sessions at AATS and STS over the last decade. In the last few years, there's been a clear increase in both care and narratives regarding diversity and equity, both for our patients and for our workforce. So our team was ultimately very interested in determining if the values that we are presenting and that we are putting forward are aligning with our scholarly activity.
Yeah, that makes a lot of sense. Definitely, we've heard a lot more talk among our colleagues, among the organizations to which we belong, about the importance of these issues. And I think, doing this study to sort out whether our presentations and the sessions that we're attending are touching on these values is certainly worthy of investigation.
Exactly.
So tell me what you found in your study.
Sure. So we actually looked at program books from 2013 to 2023, both from the AATS and STS meetings, and ultimately found that over time, talks, and that included invited talks, accepted abstracts, and sessions all increased with regard to patient outcomes and workforce. And interestingly, the largest jumps were within patient outcomes, both for invited talks and sessions, and then secondly, workforce issues. Again, invited talks and abstracts that were accepted.
Okay. And did you notice any particular point in time where things suddenly changed, or was it a gradual increase? What was the longitudinal change over time?
So interestingly, right, there was some variability in sort of the earlier years, and then at 2019, which I think makes a lot of sense, there was sort of a national, both within our country and also within medicine and surgery, a sort of a national consciousness change with regard to diversity for patients, for people, for our workforce, and then there's a huge jump sort of from 2019 until 2022.
Got it. Were you able to get a sense of kind of what percent or what proportion of overall papers or presentations were touching on these types of topics?
Yes, yeah. Actually, in fact, of over 7,000 talks, there only were 2.1% that were actually related to diversity and equity in any component.
It's really interesting to hear 2.1% because I feel like this is a topic that we frequently hear at plenary sessions or when leaders are talking to us about major changes and challenges that are facing our specialty. So recognizing that this is such a huge challenge for us in an area where, again, we really do care deeply and passionately about making changes, 2% doesn't seem like an adequate amount.
Exactly, and it's so interesting because there's also that proportion is so much greater in the second half of this time period, the study period, as compared to the first. And when comparing the first 5 years to the last 5 years, there was a fourfold increase actually of all talks and all sessions. So even in the last few years, if you think about the first 5, that percentage is much smaller and actually disproportionately seen in the last 5 years.
Got it. So if this is such a huge priority for us and something that's very important, what's the right number?
Yeah.
What percent should be about diversity and equity in our care?
Yeah, it's such a hard question because there's so many meaningful areas of science and so many areas that we want to present.
Right.
My sort of dream or my vision would be hopeful that every session has at least one presentation including diversity or equity, and then every day of a conference has a session related to these issues as well.
Yeah.
And then we'll sort of see how it goes from there ultimately.
Yeah, absolutely. I mean, it makes a lot of sense trying to align these important values, these important goals with the scholarly activity that we're doing. Do you have any plans for any other projects, perhaps to look at the makeup of our publications and how many of them are related to diversity or anything in that area?
Yeah, absolutely. I think first there's a hope of also sort of understanding how many of these abstracts go on to publication. I think that's an important component. And then understanding exactly right, sort of in a few years' time, how many things are published that are related to these issues.
Yeah, terrific. What were the take-home points if you were to kind of summarize the study for people who maybe won't get a chance to see your presentation?
Of course. So I think first there has been exponential and an explosion in these topics over the last few years, particularly over the last decade, but more specifically since 2019.
Mm-hmm.
But even that, as we just spoke to, it represents a very small proportion of overall presentations. And I think there are significant barriers to that, including prioritization, timing, funding, which are beyond the scope of our study, but still important to consider.
So it sounds like those are some key action items for people who are either listening now or had a chance to see your talk tomorrow, just recognizing that we do need research funding for these types of activities. We need to recognize them as important areas of research and to recognize even that scholarly rigor of these types of studies.
Exactly right.
Yeah, terrific. Well, thank you so much for your time, and I hope you're enjoying your first AATS meeting.
Thank you so much.